Hello, my name's Dr. Meriel Raine. I'm a GP at 19 Beaumont Street Surgery in Oxford, and I offer an IUD and IUS fitting service here in the surgery. It's available and free to all our NHS patients. My colleague Deborah Wooler also fits the devices as well. Occasionally we'll have doctors in training fitting them under our close supervision, and from time to time other colleagues may join us. We're both very experienced in fitting these devices. We both hold up-to-date diploma of the Faculty of Sexual and Reproductive Healthcare, and we've been offering this service for some years. I'd like to tell you a bit more about what happens. So if you come and have a device fitted, we offer the service usually on a Monday afternoon. My colleague Deborah offers it on a Tuesday afternoon on some occasions. The appointment lasts for half an hour. We'll ask you to wait in the waiting room for 20 minutes afterwards. You'll have a nurse or a healthcare assistant with you all the way through the procedure to make sure you're okay and make sure that you're comfortable. I always recommend that people take some painkillers before they attend the surgery, either 400 milligrams of ibuprofen or 2 paracetamol tablets half an hour before their appointment. So a contraceptive device is supplied in a fitting tube, which is like a straw with a handle. And in order to insert the device into your womb, I need to slide this through your cervix. So in order for this to happen, I need you to be lying on the bed. I'll examine you first to check the size and shape of your womb. I'll then have a look at your cervix with speculum. I'll slide the introducing tube in the womb and the device will be released. The actual procedure probably takes about 5 minutes, but as I say, the whole appointment takes about half an hour. It is a bit uncomfortable having a contraceptive device fitted. It's more uncomfortable in women who haven't had children than in those who have. And that's because the process of stretching up your cervix causes some crampy discomfort. It's not a sharp pain, it's crampy like bad first day of period pain. I always offer people anaesthetic, and the anaesthetic I use is injectable. I don't always use it, so I will always give women the option of what they want to do, but quite often it seems to be acceptable to start off the procedure and see how it feels, and if it's acceptable, then to complete the procedure without needing any anaesthetic at all, and that's what happens in most cases. But at any point that the person feels it's too uncomfortable, I'll stop and immediately put in some anaesthetic, which will work within a minute or so. The other thing that you need to be aware of is that some people feel faint after they've had a device fitted, and that's because irrespective of whether it's uncomfortable or not, sometimes the procedure of stretching the cervix causes you to feel faint and a bit nauseated, and this is the minority of women, but some women will feel that they need to lie down for some time afterwards, about half an hour, and sometimes they feel a bit nauseated, and this is the reason that I always warn people that they should allow themselves a 20-minute period of sitting in the waiting room afterwards to make sure that they feel quite okay to carry on with their day. So there are a few things that it's also useful to know about your IUD or IUS appointment. I'd recommend that you take some painkillers beforehand, so some ibuprofen, 400 milligrams, or 2 tablets of paracetamol half an hour before you come. It's a good idea not to drive or cycle to your appointment, just in case you're feeling not particularly like cycling back afterwards. You can anticipate having some crampy pain like the first day of a period that can persist for 24 to 48 hours. That's not at all unusual. You can take paracetamol and ibuprofen and it will settle down, but it's partly your wound's response to having the device fitted. if you're using hormonal contraception, I can fit the device at any time during your cycle, including when you're bleeding. If you're not using hormonal contraception, so that means if you're using condoms or you're using a diaphragm, you need to abstain from intercourse from the first day of the period until the device is fitted. It's obviously important that you're definitely not pregnant before we fit such a device, and that's the reason for that restriction. So after your fitting, you'll be fine to go home. If you've had a copper device fitted, it's effective immediately. If you've had a Meriel Raine IUS fitted, if you've had it fitted in the first week of your period, on days 1 through to 7, it's effective immediately, but on any other day of the period, you should wait 1 week before relying on it. It's perfectly safe to have intercourse with another method of contraception. You should, when you're comfortable, feel for the threads and make sure that you're able to feel them and you're happy with that. I'll ask you to come back for a checkup to check that everything is fine in around 6 weeks after the fitting.